So we have discussed the pleura till now, pericardium till now, which were covering the heart and the lungs. Today we are going to discuss peritoneum. The pleural cavity and the other cavities, pericardial cavities, were very easy because there was one organ and then it was covered by visceral pericardium, visceral pleura, parietal pleura. Okay. एक मिनट क्या है पार्ले जी, ये मालूम है क्या है आपका? जब आप रेसिडेंसी ज्वाइन करोगे ना, रेसिडेंसी, तो रेसिडेंसी में यही आपका ब्रेकफास्ट है, यही आपका लंच है, यही आपका डिनर है. स्पेशली इफ यू ज्वाइन हेवी हॉस्पिटल्स लाइक साइन हॉस्पिटल. साइन हॉस्पिटल में there is such, it is the first approachable hospital. I worked at Sion for 9 months. First approachable hospital from Sion Panvel Highway or BMC Hospital. There may be some others, but everybody goes Sion. And the world's largest slum, Dharavi, is the next. Huge patient load and tremendous experience also for those who want to learn. And so much experience that that nowadays, of course, things have become better. Now government has come out with a rule that only 48 working hours and all. But I'm not talking about the current situation. I'm talking about situation which was there 10 years back, where residents at Sion used to survive on a similar hospital where residents used to survive on Parle-G was in Pare, and the name of that hospital was a maternity hospital, famous maternity hospital in Pare, Wadia Hospital. There was a time where half of the Mumbai was born in a Wadia hospital. One of my batchmate, she was supposed to join on Monday residency in gynecology, and she went to see, where is the unit, which unit. She was allotted a unit, and on Saturday she just went there to just check where I have to come. So she went to the maternity room where unit was on emergency. He said, I am a doctor, I don't want to tell her name, and I am joining in Wadia maternity from Monday. He said, you are in our unit? Come on. And she went in just for inquiring on Saturday morning, and Monday morning they reviewed her. Okay, now you give your joining and take some rest and come back in the afternoon. There used to be 20 females delivering babies at single point of time. And then doctor used to be watching. इधर से baby निकाल रहे तब तक दूसरा बाहर आ रहा है already. तो इसको निकाल के then running. Literally that was the situation at Wadia Hospital at some point of time. So, who is our friend in residency? पार्ले जी. इसको रखना है पॉकेट में. क्यों रखना है? Because when we go empty stomach to the wards, when we go empty stomach to the OPDs, you are susceptible to infection, and the most dreaded infection for doctors is ex-MDR, tuberculosis. MDR masale nahi, multi-drug resistance tuberculosis. So your physiology, you have learned that WBC count goes up after meals. It is low empty stomach. That is the philosophy. Whenever you are entering the hospital, of course I would advise go. इतना खा मत तो अभी ठीक है, it's okay. So whenever you eat something, the WBC count, that is our resistance, goes up. Thank you. Now the difference between peritoneum and pericardium pleura is that here some organs are intraperitoneal, some are retroperitoneal. Okay, some are intra, some are retro, behind the peritoneum. Okay, so let's make a list of organs, and it is very easy to remember which organs are covered by peritoneum and which are not. It just goes alternate. So here I am making a list of intraperitoneal organs, and here I am making a list of extra or retroperitoneal organs. So how do we make this list? Start with stomach. Stomach is intraperitoneal. What is the next organ after stomach? After stomach is duodenum. Duodenum is retroperitoneal. After duodenum is jejunum and ileum, which is intraperitoneal. And after jejunum and ileum is ileum and cecum, which is retroperitoneal. Attached to cecum is appendix, which is intraperitoneal. Okay? And after that, there is ascending colon, which is retroperitoneal. Ascending colon, which is retroperitoneal. After that, there is transverse colon, which is intraperitoneal. And then there is descending colon, which is retroperitoneal. Then there is sigmoid colon, which is intraperitoneal. So just go alternate. Then in retroperitoneal organs, there is kidney, there is pancreas. Kidneys, there is pancreas also. Each of these intraperitoneal organs, their peritoneum has a special name. The peritoneum covering stomach is called omentum. Peritoneum covering jejunum and ileum is called mesentery. Peritoneum covering appendix is called mesoappendix. Peritoneum covering transverse colon is called transverse mesocolon. And peritoneum covering sigmoid colon is sigmoid mesocolon. Sigmoid mesocolon. Thank you. Okay, I am repeating again for all of you. There are so there are intraperitoneal and retroperitoneal organs. Okay, intraperitoneal are stomach, then next duodenum is retro, jejunum ileum is intra, cecum is retro. Here only you have to remember, appendix is intra, ascending colon is retro, transverse colon is intra, descending colon is retro, sigmoid colon is intra, and then there is kidney and pancreas. Rectum, of course, is almost like a retroperitoneal organ, but it is covered by peritoneum anteriorly and sides in the upper one third and only anteriorly. So we don't count it as an intraperitoneal organ. So rectum also is kind of a retroperitoneal. It's not covered by peritoneum by all the sides. Okay. understanding peritoneum is one of the most difficult tasks, especially if you are sitting in that corner over there. उधर से दिख रहा है आपको मैं क्या ड्रॉ कर रहा हूँ? मुझे ना ये ऊपर करने का डर ही लगता है. लास्ट टाइम याद है कि आपको क्या हुआ था? फक्त खेळावरती असं ते ठेवलं. So now I am taking you to the embryonic life, step 1. So this is the transverse section of abdomen. साइड उधर खड़े रहो कॉर्नर में, वो साइड पे जो पकड़ो ऐसे इधर से, उस पर नहीं, ये ऊपर का पकड़ो पकड़ो पकड़ो, हाँ पकड़ के रखो. तू पण हळूच सोडत आहे. चालू कर देतो ना. because they were not able to see ना, बरोबर ना? देवा आपको दिख रहा. So this is anterior, this is anterior, this is posterior over here, posterior side. Okay, here is the developing stomach, here is the developing stomach. Okay, the stomach is connected to the anterior abdominal wall by a fold of peritoneum called as mesogastrium. लगेच ओमेंटम म्हणायचं नाही, काय? Mesogastrium. This mesogastrium surrounds the stomach. It surrounds the stomach, okay, and goes to the posterior abdominal wall. Goes to the posterior abdominal wall, and this is called as ventral mesogastrium, and this is called as dorsal mesogastrium. Ventral mesogastrium and dorsal mesogastrium. Okay. एक मिनट. So this is the stomach. Again, it is connected to the anterior abdominal wall by ventral mesogastrium. It is connected to the posterior abdominal wall by dorsal mesogastrium. So this is mesogastrium is nothing but our peritoneum. Okay, ventral mesogastrium and dorsal mesogastrium. So this is step 1. Now as the development progresses, what is going to happen is, here again there is stomach, this is ventral mesogastrium, but in this ventral mesogastrium develops liver. So now ventral mesogastrium is divided into two parts, anterior abdominal wall to liver, which is called as falciform ligament, and liver to stomach, which is called as lesser omentum. And in the dorsal mesogastrium develops spleen. So now we have a component in the dorsal mesogastrium running from stomach to spleen, which is called as gastrosplenic ligament. And here on both the sides are kidneys, which are retroperitoneal. So running from spleen, okay, running from spleen to the left kidney, right now I am just concentrating on the left kidney, is lienorenal ligament, and so this ligament is called lienorenal ligament. So ventral mesogastrium gets divided into two parts, falciform ligament and lesser omentum, and gastrosplenic ligament and lino-renal. Lino refers to spleen. Okay, lino-renal. Now this is a transverse section. ये क्या है? Transverse section. तो हमने बोला dorsal mesogastrium running from stomach to spleen forms. Sorry, madam. Gastrosplenic ligament. But understand one thing. Now this is one diagram which I am going to draw and rub again. That this हरी ये क्या है? नीचे नहीं, पीछे गैस्ट्रोस्प्लेनिक लिगामेंट. ओके, थैंक यू. बट ये एक एंगल में है. विशाम, यू आर अंडरस्टैंडिंग दिस? दिस इज जस्ट वन एंगल. दिस इज जस्ट वन एंगल. हे मध्ये येते का कोणाचं? दिस इज जस्ट वन एंगल. नको नको, तुम्ही नका हो, दोष खाली. लाइनो-renal. लाइनो refers to spleen. So ये अगर हम ऐसे ड्रॉ करें, ये स्टमक है और ये स्प्लीन है, तो स्टमक एंड स्प्लीन आर कनेक्टेड टू ईच अदर बाय व्हिच लिगामेंट? गैस्ट्रोस्प्लेनिक. बट ये एक एंगल में आपको दिख रहा है. सो दिस पार्ट ऑफ डॉर्सल मेसोगैस्ट्रियम which runs from stomach to spleen, in one angle it forms, in one level it forms gastrosplenic, another level it forms gastrophrenic ligament. Gastrophrenic ligament. And at lower level it forms greater omentum. It forms greater omentum. It forms greater omentum. Okay? You will understand this when I will draw the vertical orientation. Now understand one thing. I am at the anterior abdominal wall. I am at the anterior abdominal wall. शाल्व झालं का तुझं प्रॉब्लेम? I am at the anterior abdominal wall. The peritoneum, parietal peritoneum is covering the abdominal wall. Two layers come here anteriorly. They go to the liver, falciform ligament. They cover the liver, go behind the liver. Then again they go from there to stomach. They go from there to stomach, cover the stomach. Cover the stomach. Some go below as greater omentum. Cover the stomach, go to the spleen as gastrosplenic ligament. Cover the stomach, go to the diaphragm as gastrophrenic. Cover. So again comes two layers coming from anterior abdominal wall. Falciform ligament covers the liver, continues as lesser omentum. Covers the stomach, continues as gastrosplenic ligament. Covers the spleen and goes to the posterior abdominal wall to the left kidney as lino-renal ligament. That's the horizontal orientation of the peritoneum. Okay. Now we are going to draw a diagram for vertical orientation. Now before I draw that, ये ऐसे सीधे नहीं रहते. Okay, they don't stand in a line. So from here, now what happens next is ये लिवर थोड़ा सा, लिवर कौन से साइड में आपके बॉडी में? सो लिवर जो है थोड़ा सा राइट साइड में चला जाता है. थोड़ा सा नहीं, बहुत सा, मतलब ऑलमोस्ट लिवर. ओके. देन here is the kidney, the left kidney, right kidney. From here, fibers are going to the spleen. So this is spleen. ये जो था ना हमारा, ये ऐसा हो गया. Spleen. From spleen, they are going to the stomach. जरा सा उसको बड़ा करता हूँ मैं, sorry. Just increase the size of this. This is the kidney. From kidney to spleen. From spleen to stomach. Okay. So stomach has come like this, spleen also has come like this, liver has gone now to that side. Now this divides the peritoneal cavity into two parts. This divides the peritoneal cavity into two parts, and those two parts are greater sac, which is front of the stomach, and here behind the stomach, you can see a space. Which is called as lesser sac. काय झालं? It gets attached to liver. या प्लेन मध्ये ते दिसत नाहीये, पण तुझ्यासाठी मी असं ओके ते होत होतं. Don't get attached to body. लिव्हरशीच अटॅच होतो, पण इकडे त्याची फ्री मार्जिन तुला अशी दिसते, ती अशी पुढे जाऊन वरती जाऊन लिव्हरशी अटॅच होते. At upper level it will get attached. So from liver, when it is running, the two layers are running like this, you get a free margin. So actually you will see the liver, and then you will see the free margin of lesser omentum going to the stomach. You can put your finger behind that. Your finger goes in the lesser sac. Okay? Finger goes in the lesser sac. So lesser sac is behind the stomach. Okay? Greater sac. Stomach is separated from the spleen by greater sac. The greater sac is not which? Greater sac. But it is separated from kidneys by lesser sac. Separated from kidney by lesser sac. Okay? You are with me on this? So here we are in a horizontal section. This is anterior, this is posterior. Stomach getting connected to anterior wall in the developmental times by ventral mesogastrium, to the posterior wall by dorsal mesogastrium. In the ventral mesogastrium develops the liver, dividing the ventral mesogastrium into falciform ligament running from anterior abdominal wall to liver, and lesser omentum running from liver to stomach. Then we have the dorsal mesogastrium in the spleen develops, which gets divided into gastrosplenic ligament running from stomach to spleen. Above it forms gastrophrenic, below it forms greater omentum. And running from spleen to the left kidney is ligaurinal. Then the liver shifts to the right side, stomach shifts to the left side, stomach and spleen in such a way, and the stomach, which was like this now, till now, the embryonic time. Now becomes during development turns like this. Anterior border turns to the right, posterior turns to the left. So now behind the stomach there is a space called as lesser sac. Lesser sac. Okay. So this is the horizontal orientation of the peritoneum. Thank you. कोण ॲब्सेंट होते हातवरती करा. पृथ्वीराज, हरी, नाव काय तुझं? हर्ष. नाव नाही तू नाही, मागची पोरांना विचारतो. हर्षच म्हणतो. हा हर्ष. तुम्ही काय कोण? दिग्विजय, कुणाल, आडनाव दोषी. दोषी तुमचा पाय ठीक झाला. तुमच्या आई बाबांना पाठवतो मी व्हिडिओ असताना कुसुम वाईट वाटत. तू पण केलंस ना. मुली कोण कोण ॲब्सेंट होत्या हातवरती करा. हा कुठले? हा 5 दिवस लागतात ना बरोबर इकडे यायला. So now we are going to talk about vertical orientation. What happens vertically? So this is the liver. This is the liver. Okay. Then here is the anterior abdominal wall. Anterior abdominal wall. Then here are the organs like urinary bladder. Okay. Then there is uterus, rectum. This is the posterior abdominal wall. So this is anterior, this is posterior, this is superior, this is inferior. Okay. Superiorly here, this is the diaphragm. This is the diaphragm. And here is the liver. Liver. मोठा काढायचा आहे डायग्राम, चिंबूसपणा करू नका. I just wanted to ask that how many of you have not purchased hard copy of anatomy textbook? Not purchased at all. Anatomy textbook. Textbook म्हणजे BED. BD चौरस है, sorry. BED चौरस है. हाँ? Or any other, Inderpir Singh, Vishram Singh, Snell's, Gray's Anatomy. Not purchased at all. बराबर से हाथ ऊपर करो. क्यों इसको पकड़ रहा है? करने देना उसके ऊपर. बाकी सबने लिया है. Now next question. How many of you have purchased but still you just read PDF? हाथ ऊपर करो. बाजू नका, आम्ही काही हे करत नाही. You don't touch the textbook at all. You are reading from the iPad. उसमें underline वगैरह सब कर सकते. My only concern about all of you who are not reading textbook is the screen time. The screen time. आप जितना मुझे बोलोगे ना गौतम कि मैं सर आज 8 घंटा पढ़ाई किया, उतना मुझे टेंशन है कि 8 घंटा तू स्क्रीन को देख रहा है. See, you look at the light like this and you close your light, it does damage. That light may be quite dim compared. That form PDF and iPad is to be used where you cannot carry a textbook. Okay, this it's good for your eyes. I'm just telling you, reading from a textbook is good for your eyes. Because here you are exposing yourself. आप कितना भी dim mode, dark mode, कुछ भी करो, ultimately that is a light. That is a light which is going inside. Okay. हाँ. Textbook से कोई light अंदर नहीं जाते. भले आपने कुछ photos देखे रहेंगे कि enlighten हो रहा है आदमी ऐसे. So now I am drawing the peritoneum. Peritoneum, what it does, हमने ऐसा देखा अभी तक, लीवर को कवर किया, पीछे गए, लेकिन लीवर को कवर करता है जब तो ऊपर भी जाता है, जो ऊपर जाता है it goes to the diaphragm, and this is coming from the anterior abdominal wall, goes to the diaphragm. Okay, goes to the diaphragm. Covers the liver like this. Covers the liver. Comes down. Goes to the stomach. Flowing from liver to stomach will be lesser omentum. Then covers the stomach and goes down. So going down from the hanging down from the stomach will be नहीं gastrosplenic क्यों? वो तो horizontal है. Greater omentum. So this is lesser omentum and this is greater omentum. Okay. Now what is this? This is below the diaphragm. Inspector working below the main inspector is called as sub-inspector. Sub-inspector. So this is subphrenic space. Sub anterior and posterior. कितने रहेंगे ऐसे subphrenic space? चार रहेंगे ना. देखो ना, ये ऐसे आ रहा है फाल्सिफॉर्म लिगामेंट और ये लेयर ऐसा ही है. तो एंटीरियरली 2 एंड पोस्टीरियरली 2. तो एंटीरियर वाला ऐसे टर्न करके जा रहा है, पोस्टीरियर वाला भी टर्न करके जा रहा है. सो पोस्टीरियरली है ना एंटीरियर. ओके. सब फ्रेनिक स्पेस. हाउ मेनी? देखो ये फाल्सिफॉर्म लिगामेंट है, ये लिवर को कवर करता है, लेकिन वो दोनों का इवन ऑन द सुपीरियरली आल्सो आफ्टर कवरिंग द लिवर दे रिमेन लाइक दिस. So and when it covers the liver, so there are 2 layers. They cover the liver like this. ऊपर anterior abdominal wall से आ रहे हैं दोनों लेयर, यहाँ से ऐसे चले जाते हैं दोनों लेयर्स. बीच में पार्टीशन है, तो दिस विल बी राइट एंटीरियर, लेफ्ट एंटीरियर. जो पीछे से कवर करके लीवर को जाता है वो भी ऐसे चले जाता है. सो देयर विल बी राइट पोस्टीरियर एंड लेफ्ट पोस्टीरियर.
क्रॉस सा बनेगा.
हाँ,
लीवर के ऊपर से प्लस सा बनेगा.
ऊपर से देखोगे तो वो प्लस भी मैं आपके लिए ड्रॉ करके दिखाऊंगा. इतना इजी नहीं है वो प्लस. So these are subphrenic spaces which are intraperitoneal. There are 2 extraperitoneal subphrenic spaces which I will discuss later. So this is This you understood? Now what happens is, this goes posteriorly, this goes posteriorly. इसको ना लेयर 1 बोलते हैं, इसको लेयर 4 बोलते हैं, इसको लेयर 2 बोलते हैं, इसको लेयर 3 बोलते हैं। आपको ऐसे ही परेशान करने के लिए उसको लेयर को नाम देके रखा है। तो एग्जाम में आपको एग्जामिनर पूछेगा लेयर 1 कंटिन्यूज एज लेयर 4, लेयर 2 कंटिन्यूज एज लेयर 3। अभी जो मैं ड्रॉ कर रहा हूँ ना, इसके अलग अलग डायग्राम्स है बुक्स में। So this now again goes to posterior abdominal wall। मैं आपको सिंपलेस्ट वर्जन ड्रॉ करके दिखाऊं। And comes as transverse mesocolon। Comes as transverse mesocolon, which covers the transverse colon। Which covers the transverse colon। Transverse mesocolon, which covers the transverse colon, again goes behind। इसको 5 and 6 भी बोलते हैं। Transverse colon is 20 inches long। Ascending colon is 5, transverse is 20, descending is 10, sigmoid is 50, rectum is 5। I am going to teach you again, don't worry about this। Okay? मैं सिखाऊंगा, मैं इधर ही हूँ, don't worry। मैंने कल रात को मेरे को सपने में मेरे KU में ट्रांसफर हो गया था। मैं बोला because then yesterday my son was not well, तो I stay next to KU hospital, उसको लेके गया था। तो पूरा घूमा, फिर सपने में मैं रात को मेरा ट्रांसफर हो गया। फिर सुबह उठा, फिर मैं देखा रहे आयर में ही हूँ अभी तक और लेक्चर दे ट्रांसफर्स करो। KU में क्यों पहुँचे हम लोग? फिर से भाई इधर ही हूँ। हाँ, तो ये इतना लंबा होता है ना कि स्टमक इधर अगर है ना, तो वो ऐसे नीचे से ऐसे स्टमक के ऊपर, तो भी ऐसा है। इधर मैंने उसको एकदम इज्जत से पोजीशन में दिखाया, लेकिन ये नालायक ऐसे जाता है, इधर आपको स्टमक के आगे दिखेगा। ये मेसोकोलोन में इतना लंबा है और एक्चुअली इज बिहाइंड द स्टमक, बट ये इधर आ जाता है एक्चुअली ग्रेटर सैक में। हाँ, दैट रिमाइंड्स मी। So what this is greater sac, lesser sac. This is greater sac and this is lesser sac. Now you could define the lesser sac, okay? And this greater sac and lesser sac, मैं यहाँ पे एक ऐसा दिखाया था ना, स्टमक, लिवर ऐसा था, तो यहाँ पे वो फोरामेन होता है। It's called as epiploic foramen। Epiploic foramen which connects greater sac and lesser sac। वो एक्चुअली राइट फ्री मार्जिन से आप ऐसे हाथ डाल के यू कैन फील द epiploic foramen। ऑल दिस यू विल बी एक्सपीरियंसिंग ऑन सैटरडे। सैटरडे को चुपचाप वापस लाना है, भूलना नहीं। ओके, नाउ इट गोज हियर, goes down, again comes here। This time it is covering jejunum and ileum। मैं इधर SI लिख रहा हूँ, jejunum and ileum। This was called transverse, so transverse mesocolon। This is called mesentery। mesentery। So mesentery is also attached। अभी इधर तो आपको एक point दिख रहा है, but actual mesentery, look here, runs like this from duodenojejunal junction to the right sacroiliac joint। ऐसे अटैच होता है, वहाँ से 2 लेयर्स आते हैं और पूरे स्मॉल इंटेस्टाइन को पढ़ करके वापस बाहर पीछे चले जाते हैं, वापस पीछे चले जाते हैं, वापस वो आते हैं। अभी क्या बचा? sigmoid mesocolon, okay? Sigmoid mesocolon, and then it dips here between the rectum and uterus, then it dips between uterus and urinary bladder and goes here। There are 2 pouches seen here। There are 2 pouches seen here। This is recto-uterine pouch and this is uterovesical pouch. In case of males, this will be the urinary bladder, this will be the rectum, and the pouch का नाम इधर अलग रहेगा. What will be the name of the pouch? Name of the pouch will be rectovesical pouch. Rectovesical pouch. In case of males, the pouch will be named as rectovesical, while in case of females, the pouch will be named as rectouterine and uterovesical. Douglas कुठे पाठीमागच्याला Douglas, pouch of Douglas. Clear? So this is the vertical orientation of the is this clear to you? Vertical orientation. So now I am talking about the vertical orientation of the peritoneum. Peritoneum, after covering the liver, goes up on the diaphragm and then goes anterior and posterior, creating subphrenic pouch anteriorly, subphrenic pouch posteriorly. Because the falciform ligament is there, okay, it will go like this, anteriorly cover the liver and reflect on the anterior abdominal wall. Posterior also goes like this, reflects posterior. So anterior will reflect like this, posterior will reflect like this, but because there is a falciform ligament has two layers, there will be two anterior subphrenic pouches, intraperitoneal, and two posterior subphrenic. This will cover the liver, go below to the stomach as lesser omentum, hangs from the stomach as greater omentum, goes to the posterior abdominal wall, again comes down and covers the transverse colon as transverse mesocolon, again goes to the posterior abdominal wall, comes down as mesentery, covers the small intestine, jejunum and ileum, again goes to the posterior abdominal wall, covers and comes as sigmoid mesocolon. So this is sigmoid colon, this is sigmoid mesocolon. Okay, here will be sigmoid colon, and then goes down, dips within rectum and uterus as recto. Uterine pouch between uterus and bladder as recto, as uterovesical pouch, and in males there will be rectovesical pouch, only one pouch. Okay. अभी मैं एक लिवर का डायग्राम आपको ये ड्रॉ कर रहा हूँ. माझ्या नंतर कोणाचं लेक्चर? 11:30 बजे किसका सेमिनार है? हाथ ऊपर करो. सेमिनार के कितने लोग प्रेजेंट है? ओंकार राऊत, महाराष्ट्राचे हास्य जात का 15 लोग किधर है? बाकी लोग क्या पीपीटी बना रहे? This is the diagram of the liver when you look from anterior aspect. तो बताते हैं. फार छान है anterior aspect, मेरे को बहुत अच्छा लगता है. असं का हंसते? हाँ, बहुत अच्छा लगता है. बिकॉज क्या है, देखो ऐसे 2 लेयर्स जाते हैं falciform ligament के. ओके, लिवर को कवर करके पीछे जाते हैं, लिवर को कवर करके ऊपर जाते हैं, ऊपर से एंटीरियर एब्डोमिनल वॉल पे आते हैं. अमित समझा आपको? ऊपर कवर करके डायफ्राम के नीचे से, तो यहाँ पे 2 पाउचेस मिलेंगे. क्लियर? तो जब पीछे जाते हैं, ये नीचे से भी पीछे जाते हैं, फिर साथ में स्टमक पे जाते हैं, फिर साथ में स्टमक पे जाते हैं. लेकिन पीछे का जो डायग्राम है वो इतना अच्छा नहीं है. जब वो पीछे जाते हैं मैं बाद में आपको बताऊंगा कि ये मैंने क्या ड्रॉ किया। क्या समझ रहे हैं? क्रॉस पूछ रहे थे ना आप, क्रॉस, ये वो क्रॉस। सो इट कम्स हियर, गेट्स रिफ्लेक्टेड एंटीरियरली, कम्स हियर, गेट्स रिफ्लेक्टेड एंटीरियरली। बट वो ऐसे यहाँ से पोस्टीरियरली जाना इतना इजी था, बट वैसा नहीं होता। यहाँ से भी पोस्टीरियर पार्ट पे क्या हो जाता है, वो यहाँ से पोस्टीरियरली चला जाता है। तो जो पाउच पोस्टीरियरली जो है ना, वो इतना ऊपर नहीं रहता, वो काफी नीचे रहता है। ओके, वो ऊपर से थोड़ा सा चला जाता है एंटीरियरली, बट पोस्टीरियरली का यहाँ से पोस्टीरियरली चला जाता है। ओके, एंड नाउ अंडरस्टैंड वन थिंग, यहाँ से जब वो पोस्टीरियरली चला जाता है, यहाँ से यहाँ पे होती है, कैसे सिखा रहा हूं आपको मालूम नहीं, वो बहुत डर लग रहा है उसको। यहाँ पे होती है किडनी, so the peritoneum goes on the liver like this anteriorly, covers it, goes posteriorly, covers it superiorly and gets reflected on the anterior abdominal wall. So you will get two subphrenic pulses, right anterior and left anterior. Goes posteriorly. From here also it will go posteriorly. But what happens posteriorly, right now I'll remove this, is seen here. So this is getting reflected anteriorly, this is getting reflected anteriorly. So here you will see the pouches, left anterior and right anterior. This is also very easy. This is getting reflected posterior. Now here posterior reflection doesn't happen from here, but it happens from here. And here what happens is, here is the kidney. So this part gets reflected from here like this and passes in front of the kidney. And this is called as hepatorenal pouch. So right posterior intraperitoneal subphrenic space is actually not subphrenic. It is, what is its name? Hepatorenal pouch. What is name for that pouch? Another name? Morrison's pouch. Morrison's pouch. Now understand what is the clinical significance of this. See, patient is lying on the table like this after the operation. After the operation, the patient is lying on the table. Okay? This is the liver. This is the kidney. And this is the hepatorenal pouch. See, and here I can show you like this in our body. When patient lies down, it is like this. So, any operation around the kidney, liver, gallbladder, the secretions, inflammatory secretions will go on the hepatorenal pouch because the patient will be lying down like this. So, therefore, many times the patient is given an angle of 45 degree or semi-erect position for resting so that it doesn't accumulate in the hepatorenal pouch, the inflammatory fluid, the pus, if any. Okay? So that's the significance. It's the most dependent area in the lying down position in the peritoneal cavity. Okay? Hepatorenal pouch or Morrison's pouch. हाँ, अभी मैंने आपको जब से आया हूं तब से मैंने आपको बोला है कि वो ऐसे पोस्टीरियर ले जाता है, फिर पोस्टीरियर से मतलब एंटीरियर आया, लिवर को कवर किया, लिवर से स्टमक को जाता है। तो लिवर से जो स्टमक को जाता है वो ये जो दिख रहा है आपको एल शेप, यहाँ से स्टमक को जाता है, लिवर से स्टमक को। So this L is where the lesser omentum will start. Lesser omentum will start and go to the stomach. And go to the stomach. Okay. So it will cover the liver like this, come here posteriorly, and from here it goes to the stomach. From here it reflects to the kidney. पोस्टीरियर थोड़ा सा आप जब देखोगे तभी आपको समझेगा। तो ये क्या है? ये क्या है? ये ऐसे गाना सुना है आपने कभी? किसने सुना? हाथ ऊपर कर। किसी ने नहीं सुना। तुम भी नका हो सकते, तुम ऑलमोस्ट माझ्या इच्छे। कोणी ऐकलंय का? वो क्या है? वो सागर है, वो सागर में पानी। अरे एक मेरे पास 3 मिनट है। So what is this? ये क्या है? These are bare areas of liver which are not covered by peritoneum. देखो यहाँ से पेरिटोनियम ऐसा रिफ्लेक्ट हो रहा है, यहाँ से ऐसे 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 जा रहा है। इस पे पेरिटोनियम ही नहीं है। यहाँ पे गॉल ब्लैडर हैंग होता है, वहां पे भी पेरिटोनियम नहीं। यहाँ पे लिगामेंट ऑफ टेरिस करके आता है, वहां पे भी लिगामेंट ऑफ टेरिस आपने नाम। सो दीज आर कॉल्ड एज बेयर एरियाज ऑफ द लिवर। बेयर एरियाज। सो दीज आर एक्स्ट्रा पेरिटोनियल पाउचेस ऑन द राइट साइड एंड द लेफ्ट साइड। ये बेयर एरियाज है, बेयर एरियाज ऑफ द लिवर। When I teach the liver, I repeat this again for you. And now coming to the last point. राहुल ये चालू करो, सिस्टम लैपटॉप चालू करो। कमिंग टू द लास्ट पॉइंट, अप्लाइड एनाटॉमी। तुम बसा ते सगळे करते। पीयूष वो नीचे खींचो, साई और पीयूष आणि आरती खींचो। तू फक्त ते खेच मग परत टायर वाजवायची गरज नाही। पीयूष मेरा वायर इधर है, इधर वायर सांभाळ। सो द अप्लाइड एनाटॉमी इकडे बघा माझ्याकडे, तिकडे काय चाललं शिकवतो। अप्लाइड एनाटॉमी ऑफ पेरिटोनियम। सी आपने प्लूराइटिस सुना रहेगा, पेरिकार्डाइटिस सुना रहेगा, पेरिटोनाइटिस। पेरिटोनाइटिस में डॉक्टर टेंशन में आता है, बिकॉज वंस पेरिटोनियम इज इन्फेक्टेड इट रन्स फ्रॉम लिवर टू स्टमक, स्टमक टू मेसोकोलम, मेसोकोलम टू स्मॉल इंटेस्टाइन टू सब कुछ शांत हो जाता है। दैट इज कॉल्ड साइलेंट एब्डोमेन, पेरिटोनाइटिस। Because all organs can get affected, it is connecting all the organs. So peritonitis. मराठीमध्ये जे डॉक्टर्स बोलतात ना, ते म्हणतात काय झालं रे, काय नाही रे, मी त्याला ऑपरेट केलं गॅस्ट्रिक अल्सरसाठी आणि त्याला पेरिटोनाइटिस बसला। पेरिटोनाइटिस बसला म्हणजे पेशंट आता बसला। ओके, सो therefore peritoneum is peritonitis is very bad, but there are good uses of peritoneum, and that is peritoneal dialysis. Peritoneal dialysis. So they put fluid in the peritoneum, and then that fluid is taken out. Because peritoneum is so vascular that if you put fluid in the abdominal cavity, because of osmosis it sucks all the toxins and that fluid comes out after 4 hours. So you don't have to do all that things. Okay, so there is one cannula made here through which the fluid is sent in and then fluid is taken out. Fluid is in. My mother, she was a patient of CKD, chronic kidney failure. She used to put the fluid, she was a politician, put the fluid, go for a meeting, address a meeting, come back, remove the fluid. But that is better than the regular dialysis, because there you are not taking out blood and all those things. So it revives the kidney thoda bahut. I say, of course, there are pros and cons in both. Regular dialysis prolongs the life. Sometimes people hear them saying, "अरे क्या तुम्हारा एलोपैथी बेकार है, बंक कैसे है?" No, dialysis. I challenge them there that when the kidneys totally shut down, you remove both the kidneys, we still have a system in our allopathic.
Roshan.
8:30 से 9:30 लेक्चर है, उसके बीच में फोन नहीं करना. So when these other pathies they challenge allopathy, यार आपका क्या है, एलोपैथी बेकार है, ये है वो है, हमारा देखो. No, हर एक पैथी का अपना अपना. In allopathy we have dialysis. So even if both kidneys are damaged, removed, still by hemodialysis, we can take the patient for hemodialysis 3 times in a week and he can survive. The longest surviving patient whose both kidneys stopped functioning is for 40 years. One person survived on hemodialysis for both kidneys at the age of 30 gray. Till 70 he lived. So that is beauty of the branch where you are working in. We are irreplaceable. ऐसे मत समझो वो लोग को जाए तुम्हारा ड्रग यार उसका साइड इफेक्ट, वो सब छोड़ो, थोड़ा बहुत है. But we can make a person survive even if his both kidneys are shut. Okay, so clap for